Alright, welcome back, Anatomy. Let's hope the volume on this one is loud enough. If it's not, please let me know. So, we're doing Chapter 5, the bone tissue. It's our first in a series of bones, so it's kind of like part 1 of 4. Okay, let's look at the bones. So, today we're going to learn about the functions of the bones, what the bones are made out of mostly, and what they do. Describe the major classes of bones. And later in the next few lectures we'll look at more towards the individual bones, but we're going to keep it broad with this one by looking at the classes of the bones. We're going to discuss the process of bone formation, where the bones come from so they can do what they do, and explain how bone repairs happen after an injury. And then we're going to discuss the effect of exercise, nutrition, and hormones of the bones, because they're very much alive and they respond to those changes in the body. See functions of all the bones. So, what are bones? Bones are made of bone tissue, and it's also called osseous tissue. It's the solid, supportive, connective tissue with a crystal matrix to make it nice and solid. And then also part of the skeletal system is the cartilage. It's semi-rigid, it's kind of gelatinous, and it also supports the body. It also facilitates movement. So the muscles are all attached to the bone, and the muscles do the actual moving, and the thing they move are the bones, and everything else hangs off the bones, so everything kind of moves. If it wasn't for bones, nothing would really move. Bones protect internal organs. They're kind of like armor. Bones produce red blood cells and white blood cells. Bones store and release minerals and fat. They have fat inside of them. But here's some bones protecting organs. The bones of the skull, and they protect the brain. Bone structures. So let's take a look at the anatomical features of bones. So bones can be divided into 3 regions. The epiphysis, the top and bottom of the bone. The metaphysis, sort of the between the tops and the middle. And the diphysis is the middle. And this all applies to the long bone anatomy. That's because long bones, they have these far ends, here and here, and these sort of middle pieces that get kind of narrow, and this long, sort of thin tubular piece in the middle. So the far away pieces are the epiphyses. So this would be the distal epiphysis of the right femur. This bone is the right femur, and this is distal because it's away from the center of the body. This round part up here is towards the center of the body, so it's the proximal epiphysis. Then you've got the metaphysis, and you could call it the proximal metaphysis, just to clarify. And it's divided from the epiphysis by this structure right here, this line, the epiphyseal line. It's a line of cartilage that makes up the growth plate, and eventually it kind of grows in with bone past a certain age. So this whole top part here, both of these parts, epiphysis and metaphysis, and it's the same down here too for them, they're full of red bone marrow, which makes blood cells. And it's also full of spongy bone tissue. And on the outside is compact bone tissue. So here, compact bone, it's kind of like the outline of the bone. And at the top and bottom of the bone, at the epiphysis and metaphysis, it's compact bone on the outside and spongy bone all the way through with marrow kind of mixed in. Once you reach the diphysis, there is no spongy bone. It's just a hollow tube of compact bone. And then there's just yellow marrow, which is all adipose tissue. It's all fat. So the bone is covered with some clear connective tissue called perosteome, and it covers the individual bones like plastic bags, and I'll discuss the purpose of that in a little bit. And then the inside of the bone also has its own plastic bag to protect the marrow, called the endosteum. And then, don't forget, there's blood vessels that kind of worm their way through the bone, and they're kind of in every layer of it, like they're inside the compact bone, and they supply the bone with nutrients. So yeah, just remember one last thing here, that this central hollow part of the bone that's surrounded by compact bone has no spongy bone in it. It's called the medullary cavity. That's where the bone keeps its yellow bone marrow. Let's move on. So, it's just the definitions of the things we covered. Endosteum is like the plastic bag lining the inside of the medullary cavity. It's where the bone grows, repairs itself, and remodels how it looks depending on the stresses that it takes. Perosteome, the outer covering, it's got blood vessels, nerves, and lymphatic vessels to supply resources and information to the bone, and to also take stuff out of the bone. The perosteome is a point of attachment for tendons and ligaments. Articular cartilage is just the cartilage on the ends of the bone. So go back really quick. Here's some, here's some. And the long bones need cartilage on the ends because they come in contact with bones and they move past each other regularly, so they need that extra layer of protection from the movement. And it's always going to be haline cartilage. And then, yeah, that just reduces the friction and absorbs shock at the joints. So, let's zoom in on the top of the femur here. So down here in the metaphysis, got the medullary cavity, and then we've got the compact bone, and then we've got the perosteome on the outside. It's fibrous, it's connective tissue, it's not epithelial, and it's got sort of a cellular layer to it, but also fiber, and passing through all of that will be blood vessels that kind of snake their way into the compact bone, and then when they're in it, they're all over it to supply it with nutrients. So up in the spongy bone, in the metaphysis, we have sort of like these tree trunk looking things, and they're sort of kind of like columns or spikes of bone, and we'll see what their structure looks like in the next few slides. But it's going to have osteoblasts making the bone matrix, osteogenic stem cells making the osteoblasts and the osteoclasts, and they're going to be arranged in rings, growing the bone outwards in rings. And then there's osteoclasts. They digest extra bone matrix, and they make the shape whatever is appropriate to contend with the mechanical forces on the bone. You can see how this circle is not very perfect. That's because these guys have shaved off the edges that don't really need to be there. And then living inside of these little caves, these lacunae, are osteocytes. They maintain the bone matrix by making sure the minerals get to where they need to go. So flat bones, they have a layer of diploid, another word for spongy bone, and it's sandwiched by compact bone on either side, just like this. And they do that to protect softer organs underneath on the deep side, and on the superficial side it's just something else like skin or some other kind of membranes. And in the inside here, what's not shown is this isn't just going to be hollow like this. There's probably going to be red bone marrow all throughout this as well. Nice bone sandwich. So, bone markings, that's a special anatomical term we have for the features the individual unique sort of features of each bone that make them kind of unique. And they come in three categories: articulations, where the two bone surfaces come together. There will be some markings there. Projections, any area that projects above the flat surface of a bone. And holes, any area that goes deeper into the flat surface of a bone. It could go all the way through, or it could just dip kind of in there. And projections are usually the attachment points of tendons and ligaments. Holes usually where vessels and nerves pass all the way through, or some of the way through. Here's some examples. Back with the femur, from the top down. There's the head of the femur, and it's like the head of this other bone, the humerus. The humerus is the long bone of the arm. The femur is the long bone of the leg, and both of them are proximal to the torso. So they're the first things coming off the torso as part of the arm for the humerus and leg for the femur. So the head is the round part. The humerus has a little hole at the top of the round part called the fovea capitis, which means the hole at the top. There's kind of some other stuff here, which can have similar names. You could call this a tubercle as well. But really a tubercle is coming off here, and a tubercle is kind of like any raised surface off the bone that's rounded, but not completely round like a head. Tubercle. The sulcus. Sulcus is a term we'll see again for other structures in the body, like the brain. It's any kind of dip or groove that's in the whole category. A tuberosity is sort of like a cylindrical raised area. It's usually in the middle of long bones. So the humerus, tuberosity. The femur kind of has one here. It's raised, but it's also rough. It's a bit of roughness there, because that's where a muscle attaches. Rough surface. Fossa. It's a little dip, and the sulcus is like a kind of like a canyon shape. The fossa is kind of like a bowl-shaped dip. Condyle. Condyle is a rounded part that's shaped kind of like a door hinge. Condyles are also here in the femur. So the humerus kind of has like sort of 3 condyles, and the humerus has 2, and you can sort of tell where they are. So the humerus, this one looks like it'll go here, right into the socket of the pelvis, and this is going to be on the right side, and so there's 2 condyles, and so this would be the medial condyle of the right femur, and this would be the lateral condyle, because medial, it's more towards the midline of the body, lateral away. These condyles, since there's 3 of them, they wouldn't really be medial or lateral, but they're condyles. Let's see. Another bone has other structures. The pelvis, it's got crests at the top. These are the iliac crests here, the right one, and the left iliac crest. The fossa, left fossa, right fossa. They kind of have their own proper names. This is just the general category. It's a fossa. What kind of fossa? We may see it again later. Sinus. The question is also, which sinus is this? It's a good question, but they generally look like this. They're cavities in bones. Foramen. It's a hole that goes all the way through. A fissure. It's a narrow hole, like a slit. Canal. It's kind of like a foramen, except it's a tube. It's not just a clean hole. And a tube. Protuberance is a raised area, and since this bone is the mandible, This protuberance, his full name is the mental process. Fun fact. So here's the breakdown of the three categories again. For articulations where the joints are, there are heads, which are completely round, like the head of the femur. They're almost spherical. Facets, flat areas. You'll find these in the vertebral joints, where each bone of the spine is flat on top and bottom, and they sit on top of each other. Condyles, rounded surfaces that are not completely spherical, they're kind of door hinge shaped. The projections, raised markings, so like the spinous process of a vertebrae. So that means backbones kind of have things on them that look like noses, and we call those spinous processes. More details on that in the next lecture. Protuberance, so we saw that in the jawbone. It's something that protrudes the chin, mental process. A process is a prominent feature. It's kind of like a hill. So protuberance is raised, protruding, kind of hilly. Process, just about the same thing. They're so close, it's hard to think of specific examples. You might even want to use these interchangeably. Spines, not to be confused with the spine of the body. That's the vertebral column. A spine on a bone is any sharp process. So it's something that sticks out, but it's like sharp and thin. Like the ischial spine of the pelvis. Protuberance. It's a small rounded process, like the tubercle of the humerus. Tubercle is not to be confused with tuberosity. It is a rough surface. The deltoid tuberosity it should be of the humerus also. I'm trying to think of where the deltoid tuberosity is, but it's in that region, and one of the three deltoid muscles should attach to it. Tuberosities are rough spots on bone where muscles attach. Line. A line is a slight elongated ridge along a bone surface, like the temporal lines of the parietal bones of the skull. Crest. A crest is a ridge. It's kind of like lower on one side, it's a little bit of a slope, and the other side is kind of a drop off, like the iliac crest. Holes. They can go all the way through. Here's their subcategories. Fossa is an elongated basin. It does not go all the way through. It's kind of bowl-shaped and shallow. Fovea is a small pit. It's bowl-shaped and a little deeper and smaller. Fovea capitalis is like a little hole. Doesn't go all the way. At the top of the head of the femur. Sulcus is a groove. Again, it does not go all the way through. It's kind of like a little canyon. The canal. The canal is the first structure here. That's a hole that goes all the way through. It's a passage in the bone, like the auditory canal, and it might be formed of multiple bones, but it goes all the way through. And it's just like a hole that's kind of cleanly punched through the bone. Actually, it might not even be that clean. It's sort of like smooth on the sides. A fissure is a slit that's been just like cut into a bone. And like, you can think of it like there's slits in the orbits of the eyes for the optic nerve to kind of slip through. The foramen structure is a big rounded hole through the bone, and they're big, you can't miss them. And meatus is any hole that's kind of like funnel shaped. It's the opening that leads into a canal. A canal is just a passage, so it's like narrow and long. Foramen is just like a clean hole punch, or like a big circular hole. And sinus, it's a space that's full of air in the bone. So bone tissue is solid with a relatively small number of cells. It's fairly acellular. It lets its crystalline matrix do all the talking. And where there's not crystals, there's collagen fibers. The collagen fibers provide a surface for inorganic salt crystals to adhere, and the crystals are mostly calcium phosphate and calcium carbonate. They're combined to make a crystal of hydroxyapatite. There's also other salts in there like magnesium hydroxide, fluoride, and sulfate to make it extra tough, and to basically cover the collagen fibers with like crystal armor. Apatite crystals give the bone its hardness and strength. They make the bone harder than steel, while the collagen fibers give the bone flexibility, so they're not too brittle like glass, but they are kind of brittle. And then the cells in the bone tissue. There's 4 types of cells in bone tissue. Osteogenic cells, they're the stem cells that make the other 3 types. Osteoblasts, they make the crystalline bone matrix. So I think first they lay down the collagen, and then they quickly cover it with bone crystal, make sure it's nice and tough. Osteocytes, they maintain the concentration of the matrix. They make sure there's the right minerals in the matrix to keep it nice and tough. They live in little caves called lacuna, and they're nourished through little cracks in the bone called canaliculi, and the cracks are there on purpose to get the nutrients to them. Osteoclasts, they will reabsorb the bone matrix. They digest the bone matrix and make sure there's not too much of it, there's not too much bone growing, not too much of the hard stuff growing. So osteocytes, they're usually inside compact bone and inside a bit of the spongy bone, and they're in the matrix. Osteoblasts are at the edge of the matrix. They are growing it outwards, and they're making this bone kind of wider because they're on the outside. Osteogenic cells are hanging out right next to them usually. And then osteoclasts, they came from these, but they moved to the inner side, to the medullary cavity side of the bone, and then digest it from the inside outward to widen the inside, so that the body can store more marrow inside the bones. Compact bone is dense and strong. It's under the prosteum, the outer covering, and it provides support and protection. It withstands compressive forces. The structural unit of the compact bone is osteon, and a very similar structure exists for the spongy bone. It's composed of concentric rings of calcified matrix called lamellae, just like tree rings. And there's always like a hollow thing in the middle called the central canal, and it contains blood vessels, lymphatic vessels, nerves. These vessels also form perforating canals. So the central canals, they run up and down, straight up and down. Perforating canals go perpendicular to these, and they cross over into different osteons. They can all trade resources, and they can also all have nervous connectivity and access to the lymph system for lipids. That's where the bone marrow gets its fat from. Osteocytes, they live in little caves called lacunae, nourished by canaliculi in the osteons. So let's find all the structures. So we have blood vessels, and they're out kind of hanging out with the prosteome, and then they kind of dig through the prosteome, and they form this perforating canal. And then they start going straight up and down in these columns of osteons, and when they're going straight up and down, they're in the central canal. So the osteon itself is a concentric ring, has many layers of the rings, and each layer is laid down by the osteoblasts. Once it's established, the osteocytes will find some nice lacunae to live in, and then they just maintain the rings. Now the osteoclasts will kind of hang out here on the edge a bit more. They're not really here too much. And they will kind of eat away at the bone from the inside, making sure that it's only as thick as it needs to be, because they want to maximize the storage space in the bone. And this would all be spongy bone, and it's made of structures called trabeculae, not osteons. Trabeculae are sort of like, they actually look just like osteons, but are thinner, and they are kind of randomly connected with each other in a lattice shape where they interlock, and they let the bone be lightweight and strong. And there's usually also red bone marrow here that is not in the picture, so if you cut into a live bone like this, it wouldn't be all dead and white on the inside. It would be red and alive and bleeding at either end, and in the middle would be yellow and full of fat. So here's the true to life image. Everything is still there. It's just not as symmetric and neat and nice as a cartoon, because in real life things are a bit messier, and it's not symmetric like this because the bone has taken mechanical stresses throughout the life of the person or other animal that it came from. But you see, sometimes the central canals are wide, sometimes they're narrow. It just depends how many vessels and nerves got crammed into each one. Like, maybe this was a couple vessels, lymph vessel and a nerve. Maybe this one was only just a nerve, or like one vessel. That's why it's more narrow. So here is an osteon again, and a trabeculae are almost identical. Osteon, nice kind of trying to be symmetric concentric rings. Osteocytes in their little lacunae. Osteoblasts all lined up on the edge. And osteoclasts are sometimes kind of around. And the difference between the two osteo things is osteoblasts, they hang out together in a line, one nucleus each. Osteoclasts are kind of alone. They got like little arms and teeth looking things and multiple nuclei. And they look like little monsters, and they go around eating up the bone tissue. Eating up the matrix, sorry, not the tissue. Spongy bone. It's also known as cancellous bone. It's got osteocytes with lacunae as well, just like compact bone. They're arranged in a lattice-like network of spikes called trabeculae. A single trabecula forms along lines of stress that the bone has naturally experienced, and they form there to strengthen the bone in those places. They are why bones are so lightweight. We've got some bones in the classroom, and if you pick them up, you'll notice they're lightweight. In fact, we got some real bones and plastic bones, and the real bones weigh lighter. They weigh less than the plastic bones. It's hard to believe that while these bones were alive, they're pretty much stronger than steel. They're so light. So, here's haline cartilage here on the head of the femur. You cut into it, it's all red. It will start bleeding immediately because it's very alive. It's making red blood cells, so it's got a lot of blood. It's also got blood vessels that are not pictured here going through it, and nerves. So it would be extremely painful to cut into it without anesthetic. And you probably might cut through blood vessels, so that will also start bleeding. But if you go here to the metaphysis, below the epiphyseal line, you look at all this red marrow here, it's red, and between the red marrow are these lattices of trabeculae, and you cut through one of them, and it looks a lot like an osteon except a little less symmetric. And there's kind of like not really much of a central canal. It doesn't need a central canal because it's literally surrounded by blood all around in the red bone marrow. It doesn't need much of a central canal. So the osteoblasts, they try to arrange all the way around to grow out more lamellae. And the osteoclasts also kind of sit on the outside instead of inside because there's no marrow. And they can change the shape of the lamellae to balance out the mechanical stresses and keep the bone thick where there's more stress and thin it out where there's less. When I say keep the bone, I mean keep the matrix, so they can kind of change the shape of this and maybe like kind of the angle that attaches the other ones. So this is just to show you guys how vascular bones are. Bones are very vascular. A lot of good blood supply in the bone all throughout. What this is not showing is also there's marrow. So this would be all red with marrow, and these would be kind of in here. The nerves are not in the picture, and neither are the lymph vessels, but they're in there too. And here this would all be yellow because it's all adipose tissue. But bones, they have a lot of activity going on. So bone formation, it follows two classic routes. The formation of bones, either way, is called ossification, and usually bones will have a cartilage scaffold to kind of follow along to grow out into their final shape. So cartilage is the template. And then there are two osteogenic pathways here, intermembraneous. The flat bones usually form this way. And endochondrial. Most of the rest of the bones form this way. The long bones, bones at the base of the skull. So intramembraneous ossification. So we have some bone, and it's all mostly haline cartilage, except there's kind of like this spot in the middle where the osteogenic stem cells have diversified into osteoblasts, and they have started forming little bone matrix particles called osteoids, and the osteoids will start coming together, and this whole bubble that they're all together in inside of a cartilage is called the ossification center. And there's collagen fibers all around it and special sort of cells in the cartilage called mesenchymal cells. We may see these again later. And if not, you'll see them again for physiology. So after a while, the bone has formed a bone matrix structure. It looks kind of like a trabeculae. It's not a coincidence. Trabecle, trabecula. And the osteoid has now kind of all toughened up and become solid. There's no lamellae yet, but there are osteocytes already maintaining this matrix, and the osteoblasts have arranged themselves in a ring to start growing out lamellae layers, lamellar layers. So the third step, C, all the trabeculae have already formed, and all the osteoblasts have left because their job is done. They are arranging themselves in a line at the top and the bottom to form the compact bone, which right now just has haline cartilage taking up that space. But there probably won't be much cartilage left at this phase already, because the mesenchymal cells have formed the perosteum already. And blood vessels have come in, and they have grown through the spongy bone to provide more nutrients to finish out the bone growing process, and also to keep the bone nourished for the rest of the time. So for the final step, The bone has kind of grown over the blood vessels. They are now like living in there. And it says the spongy bone marrows contain the red marrow at this point. It's just not colored red. It's already grown in there. And now the compact bone has already formed this layer that was not in the previous picture, and the osteoblasts will stay there and maintain that layer as needed. They're also in there maintaining the spongy bone as well. And they keep growing it as needed, and osteoclasts will keep trimming it away from the inside. And that's a formed flat bone. So for a long bone, we start off with a haline cartilage outline of the shape that the bone will take. The calcification gets started from those sites where it starts, and it's very similar to the flat bone process. Then arteries will start to kind of come in and grow through the forming bone, and the primary ossification center would have hardened around these early arteries already. And then the medullary cavity will grow all the way out like a flat bone. But here's where it gets a little different for the long bones. The metaphyses and epiphyses are kind of separate. The haline cartilage will stick around at the articulation points. The tops of the bones, the heads or the condyles, depending on which side you're talking about, they will get blood vessels growing into them, and then they will start ossifying as a separate step that goes just like this earlier one. Then the haline cartilage will just move to the exterior here of the bone because it wants to protect it at the site of a joint. This bone will grow out as spongy, and then it will be compact on the outside. It's a little different than the middle part of the bone. The epiphyseal plate will kind of form right there, waiting for a time to grow a bit later, so it's not completely done. But this basically kind of makes it so that blood vessels will come in through the top and the bottom, and they may or may not go all the way through, but they came in at kind of different points. Here's another cartoon kind of showing the bone growth process of how they grow in length. So at the epiphyseal plate, what will happen is we've got those arteries that came on top, those arteries that come from the bottom, and in the middle, where the arteries kind of don't connect all the way, we have this reserve zone where it's haline cartilage, and the matrix gets produced here. And then as there's a matrix, there's a lot of mitosis, proliferation of the stem cells. They differentiate and mature into osteoblasts. They get lots of nutrients. They calcify. And then they make bone matrix and they die off quickly. And this just gets layered and layered on top of itself, pushing the top of the bone, like the head of the femur, up higher, making the bone taller. There needs to be like a few arrows kind of pointing out what's moving where, but that's kind of how it works. For the bone growing wider, it's pretty simple. It's a bunch of osteoblasts on the outside, and they grow another lamellae. A bunch of lamellae layers. This leaves the old inner layers, and the osteoclasts trim them away to make more space for fat in the medullary cavity. That's it. And this has important implications for what happens when you exercise. So bone repair section. So we'll come back to that thought from the previous one. Let's start to wrap it up here by talking about the implications of how bones get hurt and how they fix themselves. Bones can get fractured lots of different ways. Nice and clean closed fracture, open fracture, The bone has left the body. It's pretty bad. Transverse, the bones have been crushed. It's been kind of powdered up a bit from being crushed from top and bottom. Spiral fracture, bone twisted and the fractured all the way around, and it's got these deep sort of fissures in it that form too. It's pretty bad. A comminuted fracture. The bone was hit in such a way that it broke into a bunch of pieces, and those kind of need to be cleaned up. And the body may kind of digest them a bit to clean them up, or they might get grown over by new bone. Gets a little complicated. Impacted. The bone was hit in one spot, and the shock went all the way up and caused it to just crack. Green stick. It was hit in some way, or maybe cut, or pulled, and it broke a little bit, but not all the way. Oblique. It's kind of broke from the side, sort of, and it's not very even. So here's another picture of the oblique. And this is why the prostrate exists, because the bone is a little bit brittle. It'll break. It's basically designed to. The prostrate is flexible and elastic. It will most likely not break unless it's like some really, really terrible severe trauma, in which case, if it breaks, the prostrate needs to reform immediately to capture as much blood as possible. And when it's all caught in this bloody sort of bag, it's called a hematoma, and it's all blood through here and nothing but space and broken blood vessels. The next step is, for the next week or two, these vessels need to heal so they stop bleeding and causing like blood to flood in here. And at that point also, the spongy bone has started to recover, and there's fragments of it kind of floating around in this fluid. Everything's gotten reconnected at this point a few weeks later. The spongy bone is reformed, and it's kind of overgrown a bit on purpose, and the prostrate is tightening up around it, and the fluid is not so much anymore. And it's almost completely fixed. The vessels are back nice and healthy and strong. Here, the fracture has healed, and you'll notice a slight difference here. The spongy bone got repaired really fast, and so there's a lot of still spaces left full of marrow. Here it's more dense. Here it's less dense spongy bone. And also it's a bit more kind of bulging. There's a bulge now in the bone. And the bone has bulged to toughen it up a little bit in that spot to try to make it so it doesn't break as easily again. I think over time the spongy bone will get dense like this, but for now it's healed and it's good enough. And the compact bone on the outside maybe is a little bit thicker as well and make the bone kind of tougher. But it's kind of never going to be quite as straight and narrow as it was before. So exercise. It's one of the most important things you can do for bone maintenance, because the mechanical stress on the bone from the weight that's exterior to the body, it's the bone can feel that weight. You know, the bone's got like nerves in it. It can feel stuff. You can feel it in your bones, type of thing. It's got nerves. But when the bone feels the stress from lifting the weights, using the muscles and the pulling forces that the muscle puts on the bone, it tells the bone there needs to be like more bone matrix there to carry all this weight. And so there's going to be minerals, and there's going to be like more collagen fibers that get made first, and then they mineralize and harden, more matrix forms. And this is why people who exercise regularly have thicker bones than people who don't exercise quite so much. This is a fact. Resistance training is very important to slow down the eventual loss of bone due to aging and osteoporosis. It's a condition where the osteoclasts are very active, and they are digesting a lot of bone matrix because they don't see it as necessary anymore, since the older person is not moving around so much. It's important for them to keep moving to avoid that. So that's another disease sort of topic idea for the final project presentation, which we'll discuss more next week, or the week after actually. Either way, it's not too hard, but here's the essential nutrients to maintain healthy bones. Calcium, of course, goes without saying. Vitamin D comes from the photosynthesis happening in the skin. Vitamin K comes from leafy green vegetables and other things like that. It works pretty much just like vitamin D. Magnesium, it's a metal and it makes the bones strong. Fluoride, it's not a metal and it makes the bones strong. Most of the fluoride kind of goes to the teeth, which are technically not bones, technically. In the same way that nails are skin, but hair is not skin. Teeth are not skin. Yeah, but maybe they might be closer to skin actually than bones. So teeth are not bones, but they're pretty similar. I will talk more about them in probably the next lecture. Omega-3 fatty acids. They've got the lipids that bones crave, and they also reduce inflammation in the rest of the body, which would normally interfere with osteoblast function. So you want the osteoblast making bone matrix. Best way is to reduce inflammation. Best way is to get omega-3 fatty acids. This just shows how vitamin D comes from sunlight, or you just eat it through food like milk, and it works in the bones, and it also works in the liver and kidney, and it does lots of stuff. So the other things influencing bone sort of growth and maintenance in the body, human growth hormone, it usually happens earlier in life, that the bones get a lot of this from the brain, from the pituitary gland, and it tells the bones to grow and to get longer and thicker, more dense, stronger. Later in life this stops and the bones do the opposite of what it tells them to do. They get thinner and weaker. Thyroxone, thyroid hormone, it promotes the matrix growth in the bones. And the bones will get this every now and then, like, it's kind of on a weekly basis type of thing. Weekly, monthly, pretty regular all throughout life. Sex hormones, they exclusively pretty much only happen like during puberty and then that's it. When there's a lot of them that hit the bone, it tells the growth plate in the bone, the epiphyseal plate, to have a growth spurt, make the bone longer, and then never do it again. Calcitriol, so this is more like a daily thing the bones are exposed to. It stimulates the absorption of calcium and phosphate from the digestive tract and sends it straight to the bone. So calcitriol makes the bones nice and healthy and have more matrix on a daily basis. Parathyroid hormone comes from like these other endocrine organs that are kind of like right next to the thyroid, pretty much the same thing, except it does the opposite of the thyroid hormone. It makes the osteoclast more active. It breaks down the bone matrix. It tells the kidneys to save as much calcium as possible, but don't let it go to the bones. So it sends it somewhere else, like to the muscles, because they use a lot of calcium as well. And it indirectly increases calcium absorption by the small intestine. So large intestine calcium absorption comes from this one. Actually, small intestine as well. Digestive tract. Parathyroid hormone is a little paradoxical because it also tells the digestive tract, get as much calcium out of the food as possible, keep as much calcium from leaving the body through urine as possible, keep it all in the body, but don't let any of it reach bone for too long. And then calcitonin. It does the opposite of calcitriol. This inhibits osteoclast activity and stimulates calcium uptake by the bones. It's not actually the opposite. It's like they actually complement each other. It's just that this one tells the body absorb more calcium from food. This one tells the bones stop getting broken down and keep your calcium. So they work together. The long bone categories. The 206 bones in the body total. Most of them are kind of just copies. A lot of them have numbers for names, so they're pretty easy to remember. Just remember where they are in order. You'll be fine. And they come in pairs because they're left and right. So realistically, even though it's 206 bones, it's like less than 100 names that you have to memorize for all of them. But they come in 6 categories. The long bones. Let's actually take a look. Like the femur, and the humerus, and these things in the legs. They're long. And technically also kind of like the ribs and the collarbone, the clavicle, those are pretty long. And also the bones in the digits are the long bones. So a lot of bones are long bones actually. Flat bones, also a very common category of bone. The sternum is basically 3 fused bones, one here, this long one, and this one. In the middle of the rib cage, and then flat, bones of the skull are flat, bones of the pelvis are flat. And flat bones usually have a lot of red bone marrow in them. They make most of the red and white blood cells in the body. That's kind of their full-time job. And they're pretty tough. They're some of the toughest bones. The sternum bones are the strongest bones in the body. Pretty much only a chainsaw can get through them, and even then it's pretty tough. It might even stop a bullet. The sternum is very strong. The vertebrae are the irregular bone category. There's potentially other irregular bones, but they're mostly kind of in the spine. They don't have shapes that fit these simple categories. Their shapes are a little weird. And then the short bones. The short bones by definition are cubic. They are not shorter versions of long bones. They have cubic shapes, just like this intermediate cuneiform bone. And actually that's its I think they actually have proper Latin names. This is just kind of a more generalized name. We'll talk about these bones for probably the next lecture. But the short bones, they're all in the carpal and tarsal region of the body. So the carpal's here, the tarsal's here, and the sesamoid bones, there's only 2 of them in the body. They're just the kneecaps. They're shaped like sesame seeds. You can't miss them. And that's it for today's lecture. Thanks again for watching.